Have any of these scenarios happened to you? You wake up at 2 a.m. with stabbing pain in your feet. You've noticed tingling in your toes when you walk, and it stops when you sit down. Or maybe you feel a burning sensation on the bottom of your feet when you run, and it's becoming more than just annoying, it's painful. I see patients every day who come in describing symptoms like these, and the first thing I tell them is, your feet are trying to tell you something. Those stabbing pains, tingling, and burning sensation, they're just not random annoyances. Your nerves are literally sending signals to your brain saying something's wrong. Today, I want to walk you through the 6 most common reasons why your feet are sending you these painful sensations. Once you understand what might be going on, you'll be way better equipped to get the help you need. But before I do, I'd like to introduce myself. I'm Dr. Ryan Berg, and I've been practicing podiatry for over 40 years in Seattle, Washington. I've written a free ebook called How to Care for Your Diabetic Feet, one of the most common causes of nerve pain in the lower extremities. You can download it in the description below. If you find the information helpful, please remember to like, hit the subscribe button, and then hit the bell so you can receive a notification every time I release a new video. First is neuropathy associated with diabetes. This is particularly prevalent in diabetics as blood sugar is not under good control who've had the condition for a long time. High glucose levels can damage the tiny blood vessels that lead to the nerves. This can result in pain, tingling, burning, or loss of sensation in the feet. While the symptoms can be hard to deal with, the loss of sensation is even more dangerous because when you can't feel a cut or an abrasion, you're more likely to develop a wound that becomes worse, infected, and difficult to heal. Learn more about diabetic peripheral neuropathy and how to prevent wounds by clicking on the link above. Another common condition causing nerve pain is Morton's neuroma. It occurs when a bundle of nerves between your 3rd and 4th toes at the base gets enlarged, inflamed, the scar tissue around the nerve, and it results in burning, tingling, or the feeling of a rock in your shoe or having a bunched up sock in the ball of your foot. And there is no bunched up sock or rock. People who wear pointy and high heeled shoes, athletes, those with flat feet, or other abnormal foot structures are more prone to developing Morton's neuroma. Initially, neuromas are mild with occasional pain and sensitivity, but eventually these symptoms can become more constant. To learn more about how this condition is treated, review the video in the link above. A third condition is tarsal tunnel syndrome. Think of it as carpal tunnel's cousin, but for your foot. There's a nerve called the posterior tibial nerve. It's a large nerve trunk that runs inside of your ankle down into your foot. And if it gets squeezed back here and compressed, it's going to radiate pain in your inner heel or arch. Anything that compresses the nerve can cause this condition, including faulty foot mechanics, injuries, swelling due to venous problems, and abnormal growths. To learn how this condition is diagnosed and treated, click on the video link above. Fourth are more chronic conditions like arthritis and diabetes. One form of arthritis is called osteoarthritis. It occurs in most people when we age. The cartilage in the joints of your feet and ankles start to break down and can add pressure on nearby nerves. In rheumatoid arthritis, your immune system is responsible. The arthritis attacks those joints, causing swelling that can compress the nerves and cause pain. Finally, even diabetes, beyond the problem with neuropathy, can cause swelling that compresses nerves. Number 5 is sciatica. This is literally a pain in the butt. Most people consider this condition back problems. It can also affect your feet as pain radiates down from the compression on the sciatic nerve. When you've ruled out everything else and you've started having nerve pain in your feet, I'll need to send you to your primary doctor or to a specialist called a neurologist who deals with spine issues. Number 6 is a pinched nerve or nerve entrapment in the foot or ankle. We've covered a few examples of this like Morton's neuroma and tarsal tunnel, but there are other ways nerves can get pinched in the foot. One of the simplest is shoes that are too tight. Footwear squeezing the ball of your foot or sides of your feet can irritate nerves over time. Athletes sometimes do this on purpose, such as rock climbers who often wear shoes a size too small to improve their grip as they climb. Soccer players have to wear very snug cleats and have to have tight-fitting, close feel of the ground. Skiers may buckle their boots a bit tight for better control, but that extra snug fit can lead to problems, causing nerve pain due to overcompression and even nail damage. A pinched nerve can also develop through an injury. You know, that time you dropped a can of soup on your foot, particularly from 3 feet high, it can really cause trouble. Or the weekend warrior soccer player. Sometimes incidents can cause a change in the structure to your foot by putting pressure and pinching nerves. Your feet might look fine on the outside, but inside have developed compression problems. Weight gain can also play a role. If you're carrying extra pounds, your feet are bearing more pressure than they were designed to handle. That extra pressure doesn't just affect your joints and your muscles, but it can affect the nerves in the feet. Finally, there's a condition called Baxter's nerve entrapment. It's when the nerve that travels along the bottom of the heel gets compressed, and it can be confused because of development of conditions like plantar fasciitis that cause pain in the same place. Here's what I want you to take away from all this. Nerve pain in your feet isn't something you should just grit your teeth with and live with. I know we live in a world where we're told to push through pain, but nerve pain is different. It's your body's alarm system telling you something needs attention. The good news is that most of these conditions are very treatable when we catch them early. The longer you wait, the more complicated treatment can become. Some of these issues can be resolved with simple changes like getting properly fitted shoes or modifying your activities. Others might need more involved treatment, but the sooner we start, the better your outcomes are going to be.